This video is not intended as a first aid training video. This video assumes you have already had first aid training, including how to know if someone is responsive and/or determine if someone is breathing and if his or her heart is beating. The information in this video is meant for caregivers in any setting. Some of the information is specific to organizations and facilities that provide care in residential settings. The term resident and client are used throughout the video for any person receiving services as a client of home-based caregivers, as well as people who reside in care facilities. The training information about how to respond to an emergency is the same in any of these situations. Let's introduce the POLST form and hear about its use in residential care settings. POLST stands for Physician Orders for Life-Sustaining Treatment. If you are a part of a care team working in residential care settings or care for clients in private homes, you may care for people who have POLST forms. This video will provide you with the what, when, where, and how this form is applied. The POLST form is a medical order. It explains what actions the client or resident wants or doesn't want in the event that they are found unresponsive, not breathing, and/or without a heartbeat. The POLST form also includes wishes related to care and treatment measures if they become very sick but are still breathing and their heart is beating. In Washington State, the POLST form is usually printed on bright green paper. Copies and faxes of a completed and signed POLST are legal and valid. The Health Insurance Portability and Accountability Act, or HIPAA, covers information about the privacy of a resident's health records. HIPAA permits disclosure or use of the POLST form to other healthcare providers who will care for the person. Sharing a POLST form or information on a POLST form with other healthcare providers is not a violation of HIPAA. The POLST form should be kept in a place that is easily found by caregivers and emergency medical providers.
If you are an owner or administrator of a residential care facility or home care agency, you will want to make sure you have a policy that addresses POLST forms. The policy should state what you will do with the POLST forms when submitted by residents, where you will keep them, and how your staff will respond to an emergency with a resident who has a POLST form.
There will be resources and information at the end of the video to help you develop policies that pertain to the POLST form. What to do in an emergency. Now we are going to cover what you, as caregivers, will do in an emergency. This video will focus on Section A of the POLST form. This is the part of the POLST form that will tell you whether or not to start cardiopulmonary resuscitation, also known as CPR. You may be first on the scene when you find a resident that needs emergency care. You must first see what kind of help the resident needs, applying basic first aid measures. If the person is responsive or is still breathing and has a heartbeat, make sure you follow the guidelines of your first aid training. Check for choking, bleeding, or other first aid needs. The resident may need to be rolled on their side to prevent choking. Call 911 or hospice if you know this is a hospice patient to get emergency medical help according to the policies in your setting. Now refer to Section A of the POLST form. If the person is not responsive, is not breathing, or has no heartbeat, and if CPR is indicated in Section A, you should follow standard procedures to begin CPR. Make sure that emergency help is on the way. If Section A of the POLST form indicates do not attempt resuscitation, this is the same as a DNR order. A resident in an emergency situation with DNAR checked would not want CPR attempted for natural events leading to their death. When you respond to an emergency situation for this resident, take the same steps that you would to determine the level of first aid need. Call 911 or hospice if you know this is a hospice patient. If they are able to respond, still breathing, and or have a heartbeat, make sure you follow the guidelines of your first aid training. Check for choking, bleeding, and other first aid needs. If the resident who has a POLST form with DNAR checked is not responding, does not have a heartbeat, is not breathing, and no signs of choking are present, you should provide comfort and basic care, staying with the patient as much as possible while you wait for emergency medical help to arrive. This person would not want to have CPR. They should be rolled on their side to prevent possible choking if they begin to breathe on their own. Remember, you must still call 911 or hospice if you know the patient is on hospice care. What about accidents or choking? If you or others have actually witnessed an accident that causes breathing to stop, such as an unexpected choking event, you should perform basic measures to help the person breathe again. If the person is choking, remove the obstruction according to your first aid training, even if their POLST form says no CPR, DNAR. An accident, such as an unexpected choking event, is not a natural cause for the resident or client to no longer be breathing. Therefore, the no CPR, DNAR does not apply until licensed or emergency medical personnel arrive. When emergency medical help arrives, show them the resident or client's POLST form. The emergency medical team will take over the care of the resident. If the person's heart has stopped beating, the licensed team member or emergency medical personnel will be able to stop resuscitation efforts according to the directions on the POLST form. This training is meant to help you understand what the POLST form is and how it affects your response to an emergency. The actions portrayed here are best learned by discussion, repetition, and practice. Please use this information to talk about real-life scenarios that may occur in the resident or clients you are working with. If you are an administrator, you will want to make sure your staff knows what to do in any emergency. If you are a caregiver, talk about this with your employer or client to make sure you know what actions will respect the wishes of the residents or clients you care for.
You, as a caregiver, are often the first to arrive when a resident has an emergency. We want to make sure you and the agency you work for are supported in honoring a resident's wishes. Please talk this over with your employer, discuss with your staff. Make sure you know what to do when you encounter a resident with a POLST form.
This video and curriculum was developed with the assistance of a team of experts from the following organizations. For more information about policies and training for caregivers, please contact Department of Social and Health Services, Aging and Long-Term Support Administration, Leading Age Washington, the Healthcare Northwest Training Partnership, Washington Healthcare Association, Washington State Residential Care Council, Adult Family Home Nurses Association. They are prepared to assist you as you develop policies and procedures and to help you access training that will keep you compliant with the regulations for your care setting while honoring residents' wishes. The Washington State POLST Task Force and the Washington State Medical Association is grateful for the expertise and commitment of these organizations in the creation of this curriculum and video. This video was made possible by a grant from the Retirement Research Foundation through the National POLST Paradigm Task Force. You will find more information on the POLST program at www.wsma.org/POLST. We also want to thank the following organizations for their oversight and ongoing support of the POLST in Washington State.